If you are over 60 and you have been looking at your hands lately and something feels off, maybe your nails have started looking paler than they used to, or there's a strange white band near the tip, or the shape itself has changed and you can't explain why, I need you to stop whatever you're doing right now and watch this video all the way through. Because what most people don't know, and what I'm going to share with you in the next few minutes, is that your nails are not just the ends of your fingers. They are a window. And right now, that window may be showing you something your liver is desperately trying to communicate. Something that, if you ignore it, could cost you years of your life. Here is the terrifying truth that most doctors don't take the time to explain. Your liver can lose up to 75% of its function before you feel a single symptom. No pain, no alarm, no obvious warning. Just a slow, invisible decline happening inside your body every single day. And by the time most people find out their liver is in serious trouble, the damage has already been building for months, sometimes years. But here is what gives me hope, and what I want you to hold on to as you watch this video. The body is not silent, it sends signals. And 5 of the most powerful signals your liver sends when it's struggling show up not in a blood test, not in a scan, but right there on the surface of your nails. Signals that most people over 60 dismiss as normal aging, or blame on nail polish, or a vitamin deficiency, or just getting older. Signals that most doctors, unless they're hepatologists, don't automatically connect to the liver at all. My name is Dr. Lumiva, and I have spent years sitting across from patients who came to me confused, scared, and asking the same question. Doctor, why did nobody tell me sooner? Today, I'm telling you sooner. Stay with me through all 5 signs, because sign number 3 is the one that shocks people the most, and sign number 5 is the one that almost everyone gets completely wrong. Before I give you the 5 signs, I need to give you 60 seconds of science, because I want you to understand the why behind everything we're going to discuss today. This isn't about scaring you. This is about arming you with real knowledge. Your liver is the largest internal organ in your body, sitting just under your right rib cage, weighing about 3 pounds. It performs more than 500 separate functions. It filters your blood, removing toxins and waste. It produces bile to help digest fat. It stores vitamins and iron. It regulates blood clotting. And critically for what we're discussing today, it produces a protein called albumin, and it processes a pigment called bilirubin. When the liver is healthy, this all happens silently, invisibly, perfectly. But when the liver starts to decline, whether from fatty liver disease, alcohol, viral hepatitis, certain medications, or simply chronic inflammation that builds quietly over decades, 2 things start to go wrong that show up directly in your nails. First, albumin production drops. Albumin is the protein that keeps fluid in your blood vessels and gives your nail beds their healthy pink color and firm structure. When albumin falls, the nail bed changes in very specific, recognizable ways. Second, bilirubin and other waste products that should be processed and removed start to build up in the bloodstream. These substances travel, they reach the skin. They reach the nail bed, which is one of the most richly blood-supplied tissues in your entire hand. And that is exactly why your nails can start showing signs of liver trouble years before a routine checkup would ever catch it. I want to tell you about Walter. Walter was 63 years old, a retired accountant from Illinois. He was the kind of man who prided himself on never missing a doctor's appointment, never skipping a physical. But he had also been drinking 2 or 3 beers most evenings for over 30 years, the kind of habit he considered completely normal, nothing to worry about. About a year before he came to see a liver specialist, Walter noticed his nails looked strange. The bottom 2/3 had turned almost chalky white, and only a thin, pink-brown band remained right at the very tip. He mentioned it to his primary doctor, who told him it was probably just a fungal issue or simply how nails look as you get older. He was told to try an over-the-counter nail treatment. It didn't help because there was nothing on the surface to treat. For nearly a year, Walter treated his nails like a cosmetic problem, and during that year, his liver was quietly, silently scarring. When he finally saw a hepatologist after a routine blood panel flagged elevated liver enzymes, the doctor took one look at his hands and asked, "How long have your nails looked like this?" Walter said, "Almost a year." The doctor said, "Your nails have been telling you about your liver for a year?" An ultrasound confirmed early-stage cirrhosis. His liver had already begun forming scar tissue, and his nails had been showing the exact clinical pattern the whole time. I share Walter's story not to frighten you, but because his story is not unusual. In my experience working with liver patients, the nail signs come early, often before jaundice, often before swelling, often before anyone feels sick at all. The question is whether anyone is paying attention. Let's get into the 5 signs. I want you to think of each one as a message from your liver, written on your nails, waiting for someone to read it. Warning sign number 1, Terry's nails. This is the exact pattern Walter had, and it is one of the most well-documented nail findings in liver disease. Terry's nails get their name from the doctor who first described them in 1954. Here's what they look like. The majority of the nail, roughly the bottom 2/3 to 9/10, turns a dull, opaque white or pale pink, almost like ground glass. Only a narrow reddish-brown or pink band remains at the very tip of the nail, near where you trim it. Healthy nails have visible pink nail beds with a clear, defined edge. Terry's nails look almost washed out, like the color has been drained from most of the nail and pushed to the very end. Here's the mechanism in simple terms. As I mentioned, the liver produces albumin. When liver function declines, albumin levels in the blood drop. Lower albumin means less protein-rich fluid supporting the tissue underneath the nail, and it also allows more of the tiny blood vessels beneath the nail bed to become visible in a diffuse, hazy way rather than a clear pink. At the same time, connective tissue changes beneath the nail contribute to that ground glass white appearance. The reddish band that remains at the tip represents the small area where the nail bed's normal vascular pattern is still closest to the surface. A study published in the Journal of the American Academy of Dermatology found that Terry's nails are present in a significant majority of patients with advanced cirrhosis, and importantly, they can appear before other classic signs of liver disease, like visible jaundice or abdominal swelling. What you should do if you recognize this sign: do not reach for a fungal nail cream or a cosmetic fix. Reach for your phone and call your doctor. Ask specifically for a liver function panel. That means ALT, AST, albumin, and bilirubin. And tell your doctor you want your liver function evaluated. Use those exact words. You have the right to ask for that test. One more thing I need to say about this sign. People over 60 often assume changes like this are simply cosmetic, a byproduct of age or years of nail polish. I understand that instinct, but I want to push back on it gently. A nail that has turned mostly white with only a thin colored band at the tip is not a cosmetic issue. It deserves investigation. Walter waited nearly a year. You don't have to. Warning sign number 2, yellowing of the nails, especially at the base. Now, I know some of you are thinking, yellow nails, isn't that just from nail polish or smoking? And you're right, those are the most common causes. But there is a specific pattern of yellowing connected to liver disease that looks different, and I want to teach you how to tell it apart. This yellowing tends to start at the base of the nail near the cuticle and spread outward, often with a slightly thickened, curved nail plate. It's not the superficial staining you get from polish, which sits on the surface and can be scraped or filed away. This yellowing comes from underneath. The cause is a pigment called bilirubin. Bilirubin is a yellow-orange compound produced when your body breaks down old red blood cells. Normally, your liver processes bilirubin and sends it out of the body through bile. When the liver can't keep up because of inflammation, fatty buildup, or scarring, bilirubin accumulates in the bloodstream. And just like it can turn the whites of your eyes yellow in more advanced cases, it can deposit into the nail bed and the skin underneath the nail long before jaundice becomes visible anywhere else on the body. This is sometimes an early, subtle clue, easy to miss unless you know to look for it. I had a patient, a 65-year-old woman named Carol, a retired librarian from Oregon, who came to see me because her daughter noticed her nails looked dingy in family photos. Carol dismissed it. She thought it was just the lighting, or maybe she needed a manicure. Her daughter insisted on a doctor visit anyway. Carol's liver enzymes came back significantly elevated, and further testing revealed non-alcoholic fatty liver disease that had progressed further than anyone expected, given that Carol felt completely fine. Her daughter's observation, "She looks dingy," was the thing that got her through the door. If someone who loves you has commented that your nails look yellow, dull, or different lately, please don't brush it off. The people who see us every day often notice changes that we ourselves stop seeing because we look at our own hands constantly and adjust to gradual shifts. Trust the observations of the people around you. Before we get to signs 3, 4, and 5, and I promise you, sign 3 is the one that's going to surprise you most, I want to ask you something. If this video has already shown you something you didn't know, if you've learned something that feels important and true, please tap the like button right now. I mean that sincerely. Not because I need the numbers, but because when you press that button, YouTube shows this video to other men and women over 60 who are looking at their own hands right now and don't know what they're seeing. Your one tap could reach someone tonight who has been dismissing this for a year, the way Walter did. That matters more than you know. And if you haven't subscribed yet, please do that now and turn on the notification bell. Every week I release videos like this one, practical, science-grounded medical information for people who deserve to understand what's happening inside their own bodies. Now, down in the comments, tell me, have you or someone you love noticed any nail changes recently that you couldn't explain? I read every comment. Your question might become someone else's answer. Warning sign number 3. White spots or white banding across the nail known as leukonychia, along with a specific pattern called Muehrcke's lines. I told you this one would surprise you. Most people have had a white spot on a nail at some point and assumed it was from an old injury, a bump, or a calcium deficiency, which is actually a myth, by the way. Ordinary white spots almost never come from calcium levels. But there is a very specific pattern connected to liver disease that looks different from a random spot, and it's called Muehrcke's lines. Here's what makes it distinct. Instead of a single small spot, Muehrcke's lines appear as paired, parallel white bands that run horizontally across the nail, separated by normal colored nail in between, and critically, they do not move as the nail grows out. That last detail is the key. A normal white mark from an injury grows outward with the nail over weeks and eventually disappears off the tip. Muehrcke's lines stay in place because they're not a mark on the nail itself. They're caused by changes in the blood vessels of the nail bed underneath, which is living tissue that doesn't grow out the way the nail plate does. The mechanism connects back to that same protein we talked about earlier, albumin. When albumin levels drop significantly due to liver dysfunction, it affects the small blood vessels beneath the nail bed in a banded pattern, creating these paired white lines. A study examining hospitalized patients with chronic liver disease and low albumin levels found Muehrcke's lines to be a reliable, visible marker of the underlying protein deficiency, often before other symptoms became obvious. There was a man named Frank, 67 years old, a retired mechanic from Michigan, who had noticed these paired white lines on several fingernails for close to 2 years. He'd shown a doctor once at a routine visit, and it was noted as probably nothing, keep an eye on it. Frank did keep an eye on it, but nobody connected it to anything further. It wasn't until Frank developed unrelated swelling in his ankles and went to a different doctor that a full liver panel was finally ordered. His albumin was significantly below normal range, and imaging revealed advanced fatty liver disease with early scarring. Frank told me afterward that those white lines had been sitting on his hands the entire time, visible in every photo, every handshake, every day, and it took 2 years and a second doctor to actually connect them. Warning sign number 4. Clubbing of the fingertips and nails. This is a change that develops slowly, so slowly that many people don't notice it happening to their own hands. Clubbing describes a specific shape change. The fingertips become wider and rounder, the nail begins to curve downward more dramatically over the enlarged fingertip, and the angle where the nail meets the skin at the cuticle, normally close to 160 degrees dime, flattens out or even reverses. There's a simple way to check for this at home, and doctors have used it for over a century. Place the nails of your 2 index fingers back to back. In a normal hand, you'll see a small diamond-shaped gap where the nail beds meet. If that gap disappears and the nails touch directly, curving into each other, that's a positive sign for clubbing. Clubbing is associated with several conditions, most commonly lung and heart disease, which is exactly why it gets overlooked as a liver sign. But chronic liver disease, particularly when it progresses to cirrhosis, is also a well-documented cause. The exact mechanism isn't fully settled, but the leading explanation involves substances that a damaged liver normally filters out. When the liver can't clear them properly, they circulate through the bloodstream and reach the fingertips, where they promote increased blood flow and tissue growth in the nail bed and surrounding tissue over months and years. A 71-year-old former farmer named Harold came to see me after his granddaughter, a nursing student, noticed his fingertips during a family dinner, and mentioned it to her mother. Harold had chalked up the shape of his fingers to just how my hands have always looked. Decades of manual labor, he assumed. His granddaughter's training told her otherwise. A full workup revealed cirrhosis that had been developing silently for years, likely related to long-term fatty liver disease that had never been formally diagnosed. Harold's fingertips had been changing shape gradually enough that he adapted to it without ever consciously registering the change, the way we all adjust to anything that shifts slowly enough. That's precisely why an outside observer, someone who sees you less often or looks with fresh eyes, so often catches these signs before we catch them ourselves. Warning sign number 5, and this is the one almost everyone gets completely wrong. Azure or blue-tinted half-moons at the base of the nail, known as azure lunulae, along with a loss of the normal pale lunula shape altogether. Now here's what confuses people. Everyone's lunula, that little pale crescent moon shape at the base of your nail, looks slightly different naturally. Some people have prominent ones, some barely have any at all, and that alone means nothing. What I'm talking about here is different. A distinct blue or blue-gray tint specifically in that crescent area, standing out clearly against the rest of the nail, or in some cases, the lunula disappearing entirely as the surrounding tissue changes color around it. This particular sign is most classically associated with a rarer liver condition called Wilson's disease, where copper accumulates in the body because the liver can't process and excrete it properly. That copper deposits in tissues, including the base of the nail, giving it that distinct blue cast. A milder, less blue-toned version of lunula discoloration and disappearance can also show up in other forms of chronic liver dysfunction, tied again to those same circulating waste products and pigment changes we discussed with signs 1 and 2. This is precisely why I said almost everyone gets it wrong. People either dismiss all lunula variation as meaningless, because most of it genuinely is, or they panic over completely normal lunula shapes that were always that way. What actually matters is simple: a new blue-tinted change, or a lunula that used to be visible and pale and has now changed color or vanished, especially alongside any of the other 4 signs we've discussed today. I'll tell you about Diane, 62 years old, a retired nurse herself from Pennsylvania, which makes her story particularly striking, because if anyone should have caught this in herself, it would be someone with a medical background. Diane noticed a faint blue-gray tint at the base of 2 nails during a routine manicure, and initially assumed it was leftover polish residue that hadn't been fully removed. It persisted for months. When she finally mentioned it to her own physician, almost as an afterthought during an unrelated visit, additional testing revealed a liver copper metabolism issue that had been quietly progressing. Diane told me that even with decades of clinical experience, she had underestimated her own body's signals because she was looking for something dramatic and instead found something subtle sitting quietly at the base of her nails. Before we move to what to actually do about all this, I want to quickly clear up 3 myths that come up in the comments of almost every video I make about nail health, because these myths are exactly what keep people from taking real signs seriously. Myth number 1, white spots on nails mean I need more calcium. This is one of the most widely believed nail myths, and it simply isn't supported by the evidence. Ordinary small white spots, called true leukonychia in medical terms, are almost always caused by minor trauma to the nail matrix, a bump, a slammed door, an overly aggressive manicure, weeks before the spot becomes visible. They grow out with the nail and disappear. They have essentially nothing to do with calcium levels. What we discussed today, Muehrcke's lines, is a completely different pattern: paired, non-moving bands, not random single spots, and it's tied to low blood protein, not a mineral deficiency. The second myth, yellow nails always mean a fungal infection. Fungal nail infections are extremely common, especially in people over 60, and they absolutely can cause yellowing, along with thickening and crumbling of the nail. But fungal yellowing typically starts at the tip of the nail and moves backward toward the cuticle, often affecting just 1 or 2 nails unevenly, sometimes with visible debris under the nail. Liver-related yellowing, as we discussed, tends to start at the base and often affects multiple nails more uniformly, without the thickening or crumbling texture you'd expect from a fungus. If you're not sure which one you're looking at, that uncertainty itself is a good reason to get it checked, rather than guessing and treating it with an antifungal cream that won't touch the real cause. And the third myth, maybe the most dangerous one. Nail changes are just a normal part of getting older. Everyone's nails change. It's true that nails do change with age in mild, predictable ways. They can become slightly more brittle, grow a bit more slowly, and develop fine vertical ridges. That kind of gradual, subtle change is normal and nothing to worry about. But the 5 signs we covered today are not that. A nail that turns mostly white with a thin colored band, a new blue tint at the base, paired lines that don't grow out, a changing fingertip shape. These are not part of the ordinary aging pattern. They are specific, documented clinical findings with a specific biological cause. Lumping them in with normal aging is exactly the trap that delayed Walter, Carol, Frank, Harold, and Diane. Every one of them, sometimes for years. Now, I want to address something before we close, because I know what some of you are thinking. You're thinking, I have one of these signs, or maybe 2, and now I'm scared. And I want to speak to that directly, because I think about this a lot as someone who communicates medical information. I do not share this information to frighten you into paralysis. I share it to move you toward action. There is a profound difference between fear that freezes and information that mobilizes. The goal of this video, from the very first word to this moment, has been the second one. Here's what I need you to take away from today. Maybe you recognized yourself in one of these 5 signs. Terry's nails with that washed out, mostly white appearance, yellowing that starts at the base and doesn't come from polish, paired white Muehrcke's lines that don't grow out, clubbing with that rounded, curved fingertip shape, or a new blue tint or disappearance at the base of your nail. If so, the right response is not to panic. The right response is to pick up the phone tomorrow morning and call your doctor's office. When you call, use these specific words. I would like to have my liver function tested. I want ALT, AST, albumin, and bilirubin checked. You do not need to explain why. You do not need to justify the request. You are 60 years old or older, and having your liver function checked is a completely appropriate and reasonable medical request. If your doctor pushes back, push back gently and firmly. Ask again. Your health is worth advocating for. If your results come back normal, wonderful. You have peace of mind and you've learned something valuable about your body. If your results show something that needs attention, you've caught it early. And early is everything with liver disease. Early is the difference between lifestyle changes and a transplant list. Early is the difference between managing your condition for decades and running out of time. Early is the difference that changes the entire trajectory. Walter, the retired accountant from Illinois whose nails turned mostly white, he caught his condition at an early stage of cirrhosis. With alcohol cessation, dietary changes, and close monitoring, his liver function has been stable for 3 years now. He hasn't needed a transplant. He hasn't needed to give up the retirement he worked for. Carol, the retired librarian whose daughter noticed her dingy nails, made significant dietary and lifestyle changes after her fatty liver diagnosis, and her most recent scans show meaningful improvement. Frank, with the paired white lines on his hands for 2 years before anyone connected the dots, is now in year 2 of a management plan that has slowed his disease progression significantly. And Diane, the retired nurse who almost dismissed her own blue-tinted lunulae as nail polish residue, is now on a treatment plan that has stabilized her copper levels completely. She tells every patient she talks to, medical background or not, to actually look at their own hands. Save this video right now, because the next time you notice something on your nails that you can't explain, I want you to be able to come back here and check. Show it to a family member. Show it to someone you love who is over 60. Because I can almost guarantee that someone in your life is showing one of these 5 signs right now and has no idea what it means. Subscribe to this channel and turn on the notification bell. Next week, I'm going to release a video that I think is going to be just as important as this one. The specific everyday habits that hepatologists say are silently accelerating liver damage in people over 60. Habits that seem completely harmless, habits that most doctors never think to ask about. You will not want to miss it. And please right now, drop a comment below. Tell me, how many of these 5 signs did you recognize in yourself or someone you love? 1, 2, all 5? Type the number. I read every single comment, and your answer might help me understand what the next video needs to cover for people just like you. Your liver has been quiet for a long time, but now you know what it's been trying to say.